So the Enugu State Ministry of Health recently busted a nurse quackery syndicate in Nsukka axis of the state, and it is quite profound because it has been one because of the amount of doctors and nurses and health workers generally who have left the country. We have left with either semi-trained or poorly trained people. In fact, not even poorly. We're talking about people who have no idea of what health or medicine is, and they are just all over the place. Doctors and medical practitioners are employing them just to come and fill in the vacant positions. Watch this video.
Yeah, we are in Nsukka on behalf of NAM Enugu State and Ministry of Health Enugu State, where we have come to see a hospital. You direct the camera where I'm talking. This is St. Franklin Hospital, and these are their faces. These are people that we met there as nurses. They are not true. They are not registered nurses. They are wearing white. Come over to me. And now we are arresting them and taking them back to. We'll take them to police. The person making this video is the police officer who came with. We are kicking against quackery in Nigeria. And Enugu State, good enough, Enugu State has started it. If you want to be a nurse, you will be a nurse. If you don't want to be a nurse, you can be any other place. And not to wear white in the name of nurses. We cannot take that anymore. So, this we have begun and we cannot stop. So, if you want to be a nurse, you're free to become a nurse. Come to us, we'll tell you how it is done. A group of massive, a joint task force coming in Enugu State, functioning in Enugu State currently. Our job is to seal all hospitals that are not registered and not operated by professionals. And people, the personnel there, we arrest them. Thank you very much.
Thank you. Well, this is actually what happens when people leave in droves, especially in the health sector. There's a video that I had done. I interviewed a doctor in Enugu State, and he explained to us what exactly is happening in the health sector, how Nigerian doctors are living in droves, how they are badly treated in Nigeria, and how they are not even earning, the adjusted amount that is supposed to be. I can only just imagine the situation. That is Nsukka. Nsukka is not really a rural area. It's a big town. It's a big city. In fact, it started to be, a state. Maybe in the nearest future, if there is anything that's going to come by, maybe creating a state. If you have to carve out a state out of Enugu, Nsukka would be considered as a state because it's actually a very big town with very good road network. But so you can imagine in that kind of town, we're seeing this number of fake health workers, all right, that is in one of the health facilities visited by the Ministry of Health. And so you can imagine what happens in the rural areas. Rural areas are crossroads. Nsukka is not a rural area. So you can imagine what happens in places like Ogu, places like Ibweze, places like Hamufu, places like Isiuso, Nimbo. You can imagine what happens in those localities that are outskirts, far, into the rural areas. This is just one of the menace caused by this Japa syndrome, and it's just so unfortunate. And I don't really know where we are going from here. Even a nurse. Ask a nurse if she has an opportunity, if she graduates from her school, what's the next thing to do? They're looking to get a better life. They want to leave this country. So it is cheaper to get somebody who is in the village, maybe who is just done with secondary school, or maybe even who is schooling. After school, she gets to the health facility and wear whites and becomes a nurse all of a sudden and takes care of our mamas, our papas we kept in the village. So sometimes some of these deaths that we see in the villages, in the rural areas, are not necessarily caused by old age. It's because of some of these health workers that are, employed by quack doctors. Because I mean, what for me, what makes you a quack person or a quack professionals is even if you are experienced, or even if you have a certificate to practice what you're doing, but while you're practicing, you tend to lower the standard by employing those who have no training, who have no business in the health sector. You just employ people just because they are human beings. They are just, as long as they can speak the language you understand and they can communicate, that's it. So you can imagine how big this facility is. It's just so unfortunate. I'm really stunned by what we hear and see every day. So sometimes I think that maybe we're not even, first of all, appreciating the level of the madness that we are in, the level of decay that we are in. The decay is mind-boggling. It's mind-blowing. Anybody that tells you certain sectors are looking good, my dear, none. It also plays out in the amount of budget that we place in health. Go and check the budget. Health is like the amongst the least allocations that the budget gives. Go and check. In the last 20 years, there's always been security infrastructure. Health is pushed back. Education at some point, was brought forth but pushed back. That's the reason why universities are shouting every now and then that they are going to go on strike. That's why you hear health workers shouting that they are really underpaid. But security, even the security that we are allocating funds to, are not even doing as much as it should do. We still have issues in the north. We still have issues in the south. We still have breaches here and there. So what's the justification for putting that amount of monies in the last 20 years, pumping monies into security in the last 20 years? If you look at the amount that has been pumped into security in the last 20 years in this country, you will be stunned. It's unbelievable. If you put at least 30% of that in our health sector, it will blossom much more than it is right now. This interview really broke my heart in so many ways than one. It broke my heart in so many ways because what happens to our doctors? The ones that are here are just here because of maybe one or two things holding them. Not that they like that they are here. One or two things, maybe family, or maybe the patriotism that comes with working in Nigeria. That's it. Nothing else. Somebody can just wake up and say, you know what, I'm done with this environment. I need to just go and find my way. And they leave. So it's terrible, to say the least. So I would rather say that the government should be quick and fast. At least just use 1 year. You are there for 4 years. Use 1 year and say, you know what, let me put monies in our health sector. Equip the environment. Pay doctors as at when due. Give them their due amounts, so that they would, stop this Japa syndrome. It's so unfortunate. I mean, if I was in that sector and I find an opportunity to go to go abroad and I'm paid well, I would take it and then maybe spend 10 years, 15 years there, and come back and invest in Nigeria, health-wise. So it really never comes back because, again, the environment there is a lot better than here. Even though you could say that the freedom we enjoy in Nigeria is not there. But what kind of freedom are you looking out for if everything is working for you? Everything is monitored. I mean, nothing really bad happens. If anything bad happens, it's easy for it to be traced. You have an environment that rewards loyalty, not just loyalty to the job, but loyalty to the country, and of course, they reward good deeds. Unlike a system that doesn't do that. So when a doctor retires under the government coffers, what happens to him? He goes back to sleep. He goes back with nothing, compared with someone who lives abroad, who retires as a medical practitioner abroad. it's unquantifiable. It's unquantifiable, and it's solely more on the government than anything. It's solely on government, and they must do something quickly to stop these health workers leaving our shores. All right, I'll leave you with the interview that I had with the doctor, telling us how bad it is in the health sector and what amount has been paid them. I'd be back afterward, but I want to appreciate you. Don't forget to like, share, and comment. I'd love to always hear from you. God bless.
I remember as of 2013, doctors in the UK were coming back to the country. Yes, then the dollar was about 126 to $1. Okay, but right now, everybody, almost immediately after graduation, everybody wants to leave the country because they're not seeing any prospect. They're not seeing any prospect. Let's bring it down to our own situation in Nigeria today, especially in Enugu State. For the doctors, you see, in Enugu State University Teaching Hospital, you want to know that doctors' remuneration is very poor. The Enugu State government has been trying a lot, investing a lot in the health system, but because of how bad it was, it's not something you just do in 2-3 days. Okay, and you expect everything to just blossom immediately. So it's going to take some time, but we need to see the government doing something towards it. Intentional. Okay, you want to look at investment aspect, you want to look at equipping the hospitals, you want to look at the personnel. Okay, would you believe that Nigerian doctors in Nsukka Park Lane, our remuneration, our salary scale is way back 2019, and yet not up to 100%. Now, our sister hospitals, like the federal government owned institutions, are already in 2024. So since 2019, we've had 2023, now we have 2024 reviewed, and yet we are still at 2019, and yet not even
for the state hospital.
For the state hospital primarily, and yet not even 100% salary scale. So our own problem in Enugu State University Teaching Hospital is two ways. Generally, we have the Japa syndrome out of the country. Here in Enugu State University Teaching Hospital, we have both the local Japa syndrome and international Japa syndrome, because people want to leave the country. People still want to leave Enugu State University Teaching Hospital to any other federal institution just because of the difference in remuneration.
We're still speaking with the Vice President, Association of Resident Doctors, ESUT, Ikemefuna Nnamani. We're speaking on the topic, Nigeria in deficit of health personnel, and why has that been and what's the way forward. Ikemefuna was actually giving us an insight into how it is right now as regards to people who are health workers in the state-owned facilities versus those who are in the federal-owned facilities. There are two ways, two movements that he's claiming that is happening, because the federal-owned have adjusted their salary structure to as early as, say, last year, 2024. But the state-owned have refused to do that. In fact, they're still in 2019 salary structure. And so people within the state structure are moving from the state-owned to the federal-owned, and even some of them are moving from the federal-owned to leave. Is that what you're trying to say?
That's exactly what I'm saying.
So what's the difference? What's the difference in terms of remuneration between the state-owned and the federal-owned facilities?
Well, the difference, I may not have the numbers right now.
But how many percentage?
But you can imagine in 2019, then there's a review, upward review, excuse me, in 2023, and then there's upward review in 2024. Now, in 2019, you may also want to know that this was before inflation. This was before subsidy was removed. This was before the dollar increase and all that. So imagine somebody, compare 2019 till today. The question is, why are doctors, why the exodus of leaving the country? Not just the doctors, including the nurses and most of other people, but primarily let's look at the doctors aspect now. as a doctor personally right now on my salary scale, I'm as poor as I was in, say, in 2021, in 2001. 2001 as a doctor now. Okay. Why is that? Imagine the price of fuel then and now. In 2019, the price of fuel then compared to what it is now, and yet after a month of working, giving my service, I earned the salary of 2019.
Oh.
So imagine the transportation expenses. Okay. Now you go to market, price value. You want to procure things now, say in the morning, breakfast, for instance. Imagine how much things were, onion was in 2019 and how much it is now. So for you to understand how bad it is, and by tomorrow, average doctor on this salary scale will say, oh, there's nothing for me here. You leave. It's not just the responsibility of immediate family. Some of us are married. We have kids. You want to pay your child's school fees. Imagine the school fees now and what it was 2019. I mean, 6 years back. Okay? And nobody asked you, hey, you're a doctor. Okay, your salary is still as it was in 2019. Therefore, your child's school fees will be compensated for. No. You have to work with the reality today. Okay? So, primarily, people are leaving the country, especially in the health factor, because of one, poor remuneration. Two, insecurity. Okay, when you talk about insecurity and all that, I will give it to Enugu State government. The governor has been trying a lot, but like I said, these things are eaten up deeply. That is not something you just do in 1, 2, 3 days and expect it to blossom. It's going to take a while, but yes, he is doing something. But this is the explanation of what we see could be the reason for the migration. Before this last election, politics was just one thing, it's about, in fact, I think the previous administration started their campaign for next tenure after barely 8 months after their assuming their first tenure. Okay, but recently, a few days ago, the Abia State governor just worked on the salary scale of the doctors, of the health workers in his state. Okay, they are aware, because before his tenure, the doctors were owed about 21 months salary. Before he came in, doctors were being owed up to 21 months salary, just like in Imo State. Okay, so he coming in, he had tried to look into it, he had tried to make some resolve and improve the system for them. All right, now for Enugu State governor, he's aware of what it is we are going through in the health system, but has he done something towards it? Yes. Is it optimal? No. Has it matured? Not yet. Okay, maybe because, like I said before, it had eaten up so deeply that it's not something you just quote and you expect it to blossom immediately. Now, is there still much to do? Yes, there is much to do, because doctors leaving, nurses leaving, the hospital, who is going to lock the clinic? If you don't have them, how is the system going to work? There is no hospital without a doctor. There is no hospital without a nurse. Otherwise, it's no more a hospital. Okay, so it's something they need to spread over. You look at the whole thing from a perspective where you try to touch every angle, even if not 100%, but make sure that the platform is balanced. Okay, you work on the infrastructure, you work on the personnel as well. You also work on the side of the patients, because if you're looking at infrastructure, you have new hospital. The old ones are still bad, they are still dilapidated. Okay, you look at that aspect, is for the patients. You now come to the personnel, look at the personnel, what is their problem? I don't expect a happy doctor when you are still on 2019 salary scale. In 2025, given to the whole thing waves that we've been through, the subsidy removal, the dollar rate differences that is affecting the whole market value and all that, a doctor cannot be happy. And if there is no happy doctor, there can be happy patients. Okay, now the Japa syndrome has become so badly that, do you know that at least every month 5 doctors will leave Parkland? Okay, in Lagos, for instance, every other month 5 doctors will leave. Doctors live in the exodus, including nurses. Okay, the system is feeling it. And then the few doctors that are remaining, they are still back in their payments. They are still back in their compensation.
Wow.
So it's not helping the system at all. It's really that bad.
You have stated how bleak it is in our system. Can it be revived? Can anything be done? Because, I mean, given the budget, even for this year, it doesn't look like anything fantastic is going to happen, except some miracle, tends to pop up. Or maybe we are looking at the 2026, and I'm not too sure that so much can even be done at that time, given the other issues that we have. Do you think there's any sense at all of patriotism that comes with being a doctor? Because some people will say, I mean, this environment trained the doctors, they gave you the platform, and now you have all the experience, you want to take it outside, the world. Does it come with that kind of sense? Do doctors feel that same way? And what can be done to even stem the tide of this movement?
Okay, I want to point out that because of how long this has been, you wouldn't be right if you start talking about patriotism and doctors being trained. By the time the professionals had left, who actually is left to train these doctors? Okay, so if it continues this way, it goes beyond patriotism. We may not have any choice anymore. Okay, now I didn't train in Nigeria. I trained in Europe. And my parents paid for it. Now, that doesn't mean I don't feel for my country. We were 10 of us that came back to this country to serve Nigeria. When you understand your roots and where you come from, you know that being a second-class citizen in any other country doesn't make sense.
Right.
If I leave the offshore of Nigeria, I'm not going to practice medicine any other place.
Why?
The reason is this: there is so much responsibility that comes with medicine. It is a whole lot of sacrifice. Okay? And I'd rather do it for my people. There are other jobs I could do abroad if I go back and be comfortable and leave my bucket list. So this medicine is a calling for some of us, and that is why we've come back to our country to do it. But I've come back to do it, and there is no good infrastructure. Security is a problem. There is no good remuneration. I watch my kids grow, and there are difficulties because of a financial challenge when I sacrifice all my life. I remember when my wife was in labor of our first child, I was in the hospital working. All right? I was supposed to be by her side, but I was in the hospital working. So this is a normal sacrifice, and in all, you don't feel appreciated. You don't feel appreciated, really. Okay. So yes, it's not about it's beyond patriotism now. This is the system not being fair to the workers, to our people. Okay. So patriotism is not just on one side. The leaders too should look at it from their own angle. Okay, these people are our citizens. They are working for us to make sure the good people of the citizens of this country have good health. Okay, so they deserve their wages. They deserve their proper placements, really. Now, about if there is a solution or something to be done. Yes, if there was no solution, nobody will be talking about it. We are still in 2019 salary scale. For instance, looking at Enugu State University Teaching Hospital, Parkland. Doctors are still in 2019 salary scale, and it is not optimal. It was under the former governor, His Excellency, Right Honorable Ugwuanyi, that this salary scale was reviewed. Otherwise, if I tell you what it was before then, over a long period of time, you will shed tears. And yet there were doctors there. There were people who decided that they will be there to help our people until this is reviewed. And they remain there. Now, this 2019 is not up to 100%. Now there's review in 2023. There's 2024 review. And we are still working. So you could feel it and appreciate that we are patriotic enough to stick back and try to help our people while we still receive these strokes on our back. So at a time, doctors collapse while they are working. This year, 2 doctors have collapsed while on duty.
Wow.
Because of overload, patient overload. Okay? And when you make this remuneration very rightly, people will come. People will come. You have more people. I remember in 2013, our doctors in Nigeria were encouraging our people to come back to Nigeria. Because things were not bad as it is today. Not that it was actually optimal. It wasn't that perfect. But a Nigerian that understands patriotism does not need gold all over. A Nigerian that understands patriotism just need to feel appreciated. Because there is no much you can do to a medical personnel to pay him up to the sacrifice he puts at work. It is 24 hours round the clock. I come out in the midnight. I come out in the morning. I come out in the evening. You come out anytime you are called. And just like every other person that go to work and you close by 4 or 5 or 6, we don't do that. You may come to work and decide, okay, you go home by 4. You're in the theater and there's a need to stay back. You don't have any choice because you're dealing with human life. You can't say let's close up or let's pack it and leave it for tomorrow. No. Okay? So you see that it is really bad that after all this understanding, average doctor in Nigeria is not appreciated. They are going to leave the country for greener pasture, hoping to come back to now invest in the country. So leaving the country is now as if they are wicked, they want to collapse the country. No, they want to look for greener pasture to still come back to reinvest in the country. So if we look at these angles, the system will be okay and everybody will envy it. I am sure that our Nigerian doctors will come back to Nigeria to work.
What is the average movement like from Parklands? I'm talking about health workers, and I would say that across board. If you say for a month, you mentioned 5, and you said Lagos.
Before Governor Mbah's first assumption of office, doctors were leaving about 10
per month.
Look at Esut Teaching Hospital. It was more like a transit center because of poor financial commitment from the government. It was a place people just stick around to wait for opening
somewhere.
A better place. Okay? Both local and international. Now, by the time Governor Mbah assumed office, there had been a lot of movement. You see, you notice some gesture and you're like, this is going to yield a good fruit. Okay? There have been a lot of gestures that you look at your neighbor, you say, let's see where it's going to. We are hopeful. Alright? So the movement had reduced, but it hadn't stopped. All the doctors that came in as of 2021, percentage of them had gone out.
How many percentage?
No, at least 60%.
60%?
Yes, at least 60%.
Of the people that came in 2021?
Had left. Now, with Governor Mbah, that's why I said gesture. About 100 doctors were employed to fill this gap. Okay? Though not enough yet, but to fill this gap. And from that time till now, some of them had left. And it will continue happening until there is this feeling, this assurance that the system is okay to survive. We're not saying to live luxuriously, but to survive. Okay, so the solution is this: look into the financial commitment for the workers, look into the facility itself, then look into other incentive that will even make the patient this thing to be there and retain them. Okay, you don't expect a patient who comes in critically ill and had some investigations to do, and that investigation, because you're not able to do it in the hospital, it can now delay their care. Okay, the personnel are there, but of being unable to do this investigation without that result, it can't guide you on what to do. So there's that delay. Okay, so this is about facility. So it's all encompassing: personnel, facility, and this way we are sure we are getting somewhere.
Okay, so what is the government saying about the salary structure that has refused to get adjusted since 2019?
On the salary structure, we've tried to engage the government, but again, engaging the government, sometimes they want to look at how serious you are. Okay, so we've tried to engage them, but maybe we've not presented to be too serious about it. So that's our next phase. We are going to go out to express how serious we are about it. Okay, then we may have the listening ear we deserve. Okay, sometimes when someone is telling you, hey, I'm dying, the person is still sitting down telling you I'm dying, you may not take the person seriously. You may think the person is just hungry until the person collapses. By the time the person collapses, then you are sure the person is dying. You start running around to do something. All the doctors in ASU Teaching Hospital right now, we are at that stage where we are saying we are dying seriously, because with how busy you are as a medical personnel in such institution, you are not able to attend to one or two other things because there is financial incapacitation. Really, you are not alive. Okay, emotional stress, psychological issues. Okay, it affects even your output in the patient care. Okay, so at a time when you have it up to this, you just have to quit. Just have to quit. Okay, so that's the next phase we are entering now, and hopefully we may get the results this year.
How much does an experienced doctor earn in a month? I'm talking about the federal. Do they end up to at least 1.5 million in a month?
Wow, experienced doctor. When you say experienced doctor,
say 5-10 years.
We are not even anywhere close to 50% of what you've just said. Yes.
Not up to 800,000?
We are not even anywhere close to it. 50% of what you just said. So
at the federal level?
What do you mean? How many years of practice are you talking about?
Between 5 and 10 years.
Between 5 and 10 years. We are not even anywhere close to 50%. Between 5 and 10 years, we are not anywhere close.
But the federal and the state?
For the federal is still not anywhere close to 50%.
Wow.
Yes, it's that bad. It's that bad. In comparison to the reality we are in today, when we say this reality, I don't know why the doctors have to cry, health workers have to cry so much for someone to listen to them. The reality is telling on everybody, okay? And nobody seems to be doing anything about it. So it's really that bad.
So you would think that in comparison to what people earn outside, I mean, when you see your friends tell you, well, maybe they're in UK, in Australia, in Germany, and they tell their friends what they earn, you know, where they are, you'll be like, well, what am I even doing in this country?
Is that what you're saying? With calmness. Imagine a Nigerian doctor in comparison with a doctor working in Australia or in UK or in America, for instance. To compare the two, it's just like when someone is getting their salary with a brown envelope, another person is getting their salary with a Ghana must go.
Wow.
Yes, but we don't always look at it that way. because the currency exchange is different. Okay, you get your money, if you eat your money where you get it from, there's a whole lot
difference.
of difference. Okay, we are not trying to be like them. What we are requesting, what we are asking for, is to be up to, just to meet up with the reality of today in Nigeria. We are not comparing ourselves with our colleagues working abroad. No, I had opportunity to move to Dubai, Arab Emirates. Okay, but what am I going there to do?
To work.
No, I'm not going to practice medicine outside Nigeria. Okay,
That's your personal conviction.
that is mine. We about 10 of us that came back to this country for this, and 3 of them are back.
Back.
Gone back to the UK.
Wow.
3 of them are gone back to the UK, and the rest of them are in the West.
Wow.
Okay, so really, we're not comparing. We are not saying pay us like them abroad. No, please just meet up with something to let us survive while we do what we do as health workers in this place.